This lecture will cover the non-Enterobacteriaceae gram-negative bacilli, gram-negative rods, that do grow on MacConkey agar. So now we're going to look at the gram-negative bacilli that are not included in the Enterobacteriaceae family. So these are going to be considered non-Enterobacteriaceae. Of course, keep in mind, Plesiomonas is covered in the Enterobacteriaceae. It is one of those organisms. However, what stands it out from the other Enterobacteriaceae is that it is oxidase positive. So that does kind of stand it out, whereas most of them are oxidase negative that are in that category. Some of the additional organisms that we will cover will be the Acinetobacter and the Stenotropomonas. Those two organisms are not Enterobacteriaceae, but they are oxidase negative. Additionally, we're going to cover the Vibrio and Eriomonas that are oxidase positive, but these also do ferment glucose. So that makes them a little bit different than the other non-Enterobacteriaceae. So because they ferment glucose, you would mistake them for one of the Enterobacteriaceae. But we're going to go over all these organisms in a little bit more detail. So going back to our flowchart, we've already covered most of these organisms, but remember we start off with looking for growth on MacConkey agar, and then determining if it is a lactose fermenter or a non-lactose fermenter. And so remember with our lactose fermenters that we do have a few that can sometimes present as a lactose fermenter. So this would be your Vibrio or your Eriomonas. And so even though they can sometimes present as a lactose fermenter, we're going to work them up in the non-Enterobacteriaceae workup. So with their, which that brings us over here to this side. So with our non-lactose fermenters, we've already covered the ones that were oxidase negative. So if they're oxidase positive, then from there we're going to do some different testing to help figure out which organisms we're dealing with. So if it is, next we would do a glucose oxidation fermentation test. And so if our organism oxidases glucose instead of fermenting it, then it would be a Pseudomonas. But Pseudomonas also has some distinctive characteristics that helps kind of differentiate it without having to do this glucose oxidation test. But then if it ferments, then we've got other tests that we will do to determine, or if we determine it's not a Pseudomonas, then there are some other tests that can be done to work these organisms up. And again, if you were in a large hospital lab, a lot of these tests would be done automated. However, if we were in a student type setting or physician's office setting, then some of these tests would be done to work up these organisms. So next I'm going to go over this flowchart. I have added a couple of organisms to this flowchart that's a little bit different than when you looked at it with the Enterobacteriaceae lesson. So of course, first what we're looking at is, did the organism grow on MacConkey? And if it did grow on MacConkey, is it a lactose fermenter or a non-lactose fermenter? And so from there, we will start to differentiate based on some spot tests. So for our lactose fermenters, I'd like to point out that Vibrio and Eriomonas is an organism that will sometimes ferment lactose, so it may give a little bit of appearance on the MacConkey agar that it is a lactose fermenter, and then sometimes it doesn't. But if you do oxidase and it's positive, you're going to be looking at one of these organisms that is over here within the non-lactose fermenters. So I included these over here because they don't always ferment lactose. So with your lactose fermenters, you do your oxidase. If the oxidase is negative, then you know you're dealing with a very select few organisms. And of course, these are the Enterobacteriaceae. And of course, all Enterobacteriaceae do ferment glucose. So keep that in mind when I talk about something fermenting glucose. If it is in one of those tubes with the sugar media in it, that the bud of that tube will turn yellow from that glucose fermentation. So keep that in mind with these organisms. All right, so back to our indole oxidase negative organisms. We would next do an indole. So with our indole test, if it is positive, then we are dealing with E. coli or Citrobacter, and then to differentiate those two, we could additionally do a citrate test, and that would help differentiate between Citrobacter and E. coli. And indole negative, we would move on to motility and then differentiate between Enterobacter, Klebsiella, Serratia, which, you know, they all have distinctive characteristics that we've already covered. Moving over to the non-lactose fermenters, we would do an oxidase. Of course, if it's oxidase positive, then our next step would be to determine, does it ferment glucose? And of course, our glucose fermenters include the Vibrio, Aereomonas, and Plesiomonas, which was covered in the Enterobacteriaceae for the Plesiomonas. We will look at the Vibrio and Aereomonas in more detail. Once you've determined that it does ferment glucose, from there you could do a string test or a DNase test to further differentiate these organisms. If the organism oxidizes glucose, so that slant tube would not turn yellow in the bottom when you're looking for the oxidation or fermentation of those sugars. And so if it just oxidizes and does not ferment, then we know that we're looking at either Burkholder, which has yellow pigment to those colonies, chlorine blood agar, versus Pseudomonas, which is very distinctive with a grape-like odor and a distinctive pigment or metallic sheen. Looking again at our indole negative organisms, our oxidase negative organisms, we would next do an indole test. Indole positive points out Proteus. Sometimes you do have some Proteus species that are indole negative, so we couldn't officially rule, if it come up indole negative, we could not officially rule out Proteus. We would still need to do additional testing. From there, you're looking at some of your Enterobacteriaceae that we've already covered, Yersinia, Salmonella, Shigella, Proteus. And then we will also look at, in this lecture, Acinetobacter and Stentropomonas. And so with these two organisms, again, these organisms do not ferment glucose. So you would get those agar slants that would be alkaline-alkaline. And then, of course, there are some other distinctive characteristics we'll review. So our gram-negative bacilli that are non-Enterobacteriaceae, so we can kind of divide those up based on their ability to ferment glucose. And if they are able to ferment glucose, then we can kind of divide those out based on their oxidase. Oxidase positive organisms would include Pseudomonas and Burkholder. With your Pseudomonas, you do have that metallic sheen with that little bit of pigment to it, and it does produce a grape-like odor. And I will note that there are other Pseudomonas organisms out there, other Pseudomonas species. However, Pseudomonas aeruginosa is the main one that is most often encountered. With your Burkholder, the oxidase is weak positive, so it could take a little bit for that to actually develop. And the difference between the Burkholder versus the Pseudomonas, the Burkholder tends to have more of a yellow pigment to it, to those colonies, and they do not fluoresce, whereas the Pseudomonas aeruginosa will have a bit of a fluorescence to it. Also with our glucose non-fermenters, we're looking at ones that are oxidase negative, and so we will cover the Acinetobacter and the Stentropomonas. For our glucose fermenters, they are oxidase positive, and we will look at Vibrio, and of course this one will grow on 6.5% sodium chloride, and it will produce a positive string test, so that kind of stands this out from the other organisms because of that positive string test. And then Aereomonas and of course Plesiomonas we previously covered. Eriomonas is DNase positive versus Plesiomonas is negative. And of course, they both do have a negative string test. Pseudomonas is found throughout the environment. It's pretty much can be found anywhere within any sort of community environment or hospital environment. And so because it can be found in a lot of places, it's just an average contaminant, then it's very easy to get a hospital-acquired type of infection from this organism, as well as a community-acquired infection. It is transmitted to the host via ingestion or through some sort of exposure of contaminated food, water, or a medical device. And there are several virulence factors associated, for example, exotoxin A. And one that's very notable is that it can produce a biofilm that is related to the alginate. And so with this, what will happen is it will actually have an overproduction of this, and then it will produce a biofilm that gives it a mucoid type of presentation. And so this is commonly what is isolated from cystofibrosis patients, that it will end up actually infecting the lungs. You know, they already have problems with clearing that fluid within that lungs, and so the Pseudomonas will actually create that biofilm, which makes it a little bit harder to treat. So what you see actually on the previous slide as well is that the Pseudomonas can actually infect different areas of the body. And so because a Pseudomonas has some very distinct characteristics, then it can cause a green type color. So you saw the nail in that last picture that had that green type color, and then you can see the infection of this eye, as well as some of the urine. Now, just because the urine is green does not mean that it is a Pseudomonas infection. Just know that it can, because it produces a pigment, that it can cause some of these infections to present with a little bit of a greenish shade to it. And so there are a variety of infections that it can cause, and like you saw with that nail infection on the previous slide, this is why a lot of hospitals say that staff must keep their nails trimmed really short, as well as they prohibit the use of artificial nails, because the Pseudomonas can live under those nails, and especially if you're working in the nursery with infants or doing any sort of wound care, then you can potentially present that bacteria to that patient, which could cause a hospital-acquired type of infection, not only from just various equipment being contaminated, but just through passing that organism from the nails itself. So occasionally bacteremia can be caused by a Pseudomonas infection, and with this it can actually progress and invade the blood vessels pretty quickly, and then it can from there go into the subcutaneous type tissue. And with this, there's an enzyme that will actually destroy the walls of the blood vessels, and will cause it to kind of start to be necrotic, and then those skin lesions will get necrotic, and then this will resemble gangrene. So this is a type of gangrene that is caused by a Pseudomonas aeruginosa. The ground stain of Pseudomonas aeruginosa will appear as medium-sized straight rods. These organisms will actually grow at 42 degrees Celsius. With your blood agar, these organisms will present as a flat spreading type colony. So you can see where these organisms kind of appear flat. They also have a very distinctive metallic sheen to them. If you remember back in one of the first few lectures where I actually showed what growth looks like on culture media, I believe there's a video in there where this particular organism is rotated on the plate, and you can actually see that reflective metallic sheen. One thing that's very notable, when you remove the plate, remove the top off the plate to look at these organisms, They do have a grape-like odor to them, so it's very distinctive. It kind of helps you identify it. They are non-lactose fermenters on the MacConkey agar. And sometimes you can have those mucoid species, especially that's seen with cystic fibrosis patients. This organism, the Pseudomonas aeruginosa, it will actually produce a diffusible pigment that will diffuse down into certain agars. And so with that, it gives like a blue type color. And so that's where you get the cyan here. And then that can actually combine with the pyroviridin type pigment, which gives it a green type color. And so that's why some of these species, if it's plated on the proper agar, then it will actually appear as a green type color. And sometimes you can see it a little bit on the blood agar if it does have a little bit of that pigment to it. For your biochemical tests, they are oxidase and catalase positive. It will dehydrolyze the arginine, and it will oxidize glucose and xylose. If this was on a TSI agar, no gas, no H2S, and you would have an alkaline slant and an alkaline butt. So this organism wouldn't have color change throughout that agar. Burkholderia cepacia is found widely distributed throughout nature, and it can also colonize cystic fibrosis patients. And so with this particular organism, it does cause chronic pulmonary infections in the cystic fibrosis population, but it also can be spread throughout that population from a colonized individual to another cystic fibrosis patient. And also exposure can come from contaminated medical devices and supplies. So with this infection, it is able to colonize the patient, and it can potentially cause a life-threatening infection in patients that are that have cystic fibrosis or who have chronic granulomatous disease. Other patients can suffer from an infection as well, so sites of these infections could be something like urinary tract infections, respiratory, or any other sterile body site. These organisms are gram-negative, short, medium sized straight rods. This organism does grow on blood agar with a colony that is more of a yellow look to it, although they don't always present with a yellow tinge to them, but they do usually have some tinge of yellow to them. On MacConkey agar, they are non-lactose fermenters, and then they are also oxidase positive, but it is a weak reaction. LDC positive, indole negative, ONPG positive. These organisms oxidize glucose, so they do not ferment it. So if you were to do one of those sugar slants, like a TSI, then you would get the butt of that slant would not turn yellow. These organisms are motile by a polar flagellum, and they are also naturally resistant to many antibiotics, so they have actually been found, this organism has been found to be present in different alcohol or iodine solutions where that solution has become contaminated and the organism continues to grow. Stentropomonas multifila is found widely distributed throughout nature and within some hospital environments. And so this organism will colonize hospitalized patients from different factors throughout the environment. They can be exposed through medical instruments like IV lines, urinary catheters. And what happens with this is that organism is actually introduced to a sterile site, and it causes that infection to take place. So you can find catheter-related infections, bacteremia, wound infections, pneumonia, UTI, as well as some other infections. This organism is a gram-negative, short to medium-sized straight rod. They are they present on blood agar as large colonies. They can have uneven edges, so you can see in this image here where they kind of they give a little bit of a distinctive view to them, where they're not really round. They're all kind of bumping up together because they're so large. But you can also see that this organism can have a greenish to lavender type hue to it. So this picture here of the blood agar, the bottom blood agar, it does have more of that green hue to it, whereas this one up top has a little bit more of that lavender pearly type look to it. These organisms can smell like ammonia on that culture plate. They are oxidase negative, catalase positive, indole negative. They do oxidize glucose, but it's a very weak reaction, but they do strongly oxidize maltose. DNase positive, esculin positive, gelatin hydrolase positives, ONPG positive, and these organisms are also motile. Acinetobacter baumannii. This organism can be found throughout the environment, including the hospital environment. These organisms will colonize hospital patients from the environment or exposure to contaminated devices. And then the patient can have a variety of infections like genital urinary type tract infections, respiratory infections, wounds, soft tissue, bacteremia. So you can actually see this organism in patients that have been exposed in the hospital environment. So more particularly like burn units or ICU patients that have been exposed in that hospital environment. These organisms are plump coccobacilli. They are gram-negative, but because of their makeup, they can tend to resist alcohol decolorization, which can actually make them appear a little bit more gram-positive than gram-negative. The colony morphology for blood agar is a smooth, raised-looking colony. You can see some beta hemolysis with it, but not always. MacConkey is a non-lactose fermenter, but something that needs to be pointed out about these organisms is that they can have a little bit of a purple hue to them when they're growing on the MacConkey agar, so that can be mistaken for a lactose fermenter. So caution would need to be used when using these tests and working up this organism. They're oxidase negative, catalase positive, indole negative, non-motile, OMPG negative, esculin negative, and of course they are oxidizers of glucose and nitrate reduction negative. These organisms do have a multi-drug resistance, so they do have to be worked up very thoroughly just to make sure that you're able to find the proper antibiotic for these. And like most of these organisms, you're not going to rely just on spot testing. They're usually something like an API strip or some sort of automated detection methods that are used to help identify these organisms.